What the master's program here really provides is a way for those already expert nurses to really understand the dimensions of that practice, but also its potential for making significant difference beyond where they may be at that point in time.
We take them to that next level of specialist knowledge, and that's what is so important. There is now enormous number of studies and evidence that shows that when you're cared for by a specialist trained nurse in cancer, the outcomes for patients are better.
This is especially relevant for bone marrow transplant patients. It's really important to understand what's important to that patient and their family and their loved ones and whoever comes in to visit them, and understanding that this is obviously a very challenging time for them, and I think that holistic care, that's really important, and that's probably something that you learn through the masters, and the importance of that and providing that holistic care.
Unlike other healthcare professions, nursing does not have a significant body of funding beyond its registration degrees, and so master's degrees are often self-funded.
Postgraduate qualifications are not funded by the Commonwealth, so they're not what we call HECS funded, they're fee paying. So the first barrier is the financial cost.
It is a really heavy and difficult job at the moment, but you see nurses that just manage so well, and they're so skilled and really passionate as well, I think, about what they do. And a lot of the time I think maybe we just need encouragement. You know, maybe it's just a few kind words and a pat on the back to say, you're doing really well. You know, you should think about this, or you should enrol in this.
Scholarships are significantly important in that space because it really helps those people who are those experts who are so capable of advancing their practice and knowledge, but just financially can't afford it.
Scholarships have been one of the most valuable tools that we've had to enable nurses to undertake this postgraduate study.
Having scholarships like TLR Foundation supporting these scholarships, I think that's a big step in maybe convincing or influencing some of our younger nurses to go on and to do the masters.
Being able to have something like the TLR scholarship and the Alan Frankel name attached to it really gives an ethos and a culture to it that helps people to feel really proud about having achieved something like this, but to use that as a platform for demonstrating how we can grow in these kind of legacies and actually really help people who need it most, and that's fundamentally what we're about.